Okay, thank you all for coming. We are here to talk about Bill 2418. Wow, and we've been joined by Brian and Lou, Special Assistant to the Planning Board Chair, my former Deputy Chief of Staff, who worked very, very hard on this legislation. I'm glad you could join us as well. I'm going to introduce a few speakers in just a minute. Dr. Travis Gales, our Chief Health Officer for the county, wanted to be here but was called away to meet with Secretary Neal up in Baltimore. So I'm very glad we are joined by his deputy, Dr. James C. Bridges, our Deputy Health Officer.
A little different, Tom. Hold on. There.
Good. We also have Matthew Lozak, the Executive Director of the Montgomery County Renters Alliance, Vicki Price, Alan and Ella Cassidy from the Charterhouse Tenant Association, Julio Murillo, the Government and Strategic Relations Specialist for CASA, Anna Levy's here from JUFJ, and I'm so glad Reverend Pat Drumming could be here from the Rainbow Congregation as well. So why do we need Bill 2419? Because this June was the hottest June in recorded history. And this July was not only the hottest July in recorded history, it was the hottest month in all of recorded human history. Yet Montgomery County's growing population of 300,000 tenants has no protection against extreme heat. There's no requirement for working air conditioning in Montgomery County Housing Code. We require landlords to provide heat, but no requirement for air conditioning because our housing code was written before climate change became a life-threatening issue. It's now time for us to have that requirement in law. Maryland has already had several heat-related deaths this summer. While we won't have confirmed statistics for a little while, we do know in 2018 there were 28 deaths in Maryland due to extreme heat. 28. And heat-related risk is not unique to Maryland. In Japan this year, they had 80 heat-related deaths, and they had tens of thousands of individuals hospitalized. France had 1,500 deaths this summer, and other European countries set records as well. This is what happens in other areas and will increasingly happen in Montgomery County if we do not take action to protect our tenants from rising temperatures due to climate change. While we're taking many steps to combat climate change, we cannot combat it on our own. We also need to enact policies in the area of climate resiliency and adaptation to protect our residents and our infrastructure from the effects of climate change. And I see this bill as the first step in that area of policy as well. Our housing law is founded on the premise that our tenants are entitled to safe and healthy living spaces, and our laws are enforced by our housing department. But without any requirement for working AC, our department is unable to require an owner to keep each unit in a safe and healthy temperature. In fact, we don't even track which apartments provide air conditioning and which ones don't. In our research for this bill, we found out we still have some apartments, incredibly, where the landlord doesn't provide any AC at all. However, what's much more common is we have a lot of older buildings with negligent owners who don't repair the buildings and keep them in good working order. Several residents of the Charter House, a Silver Spring apartment building for seniors, are here today, and several residents in that building were hospitalized this summer. This groundbreaking bill, a first in the region, simply requires working AC in every rental unit in Montgomery County. It requires indoor temperatures that don't exceed 80 degrees between May 1st and September 30th. It's complementary to our requirement for heating during the cold months, and it's in line with our emphasis on racial equity and social justice that we're particularly emphasizing this year and going forward. And it's absolutely consistent with the legislation we recently passed, allowing tenants who are facing health and safety issues that have not been addressed by their landlords to break their leases without financial penalty. Like mold and vermin and broken smoke detectors, extreme heat is really a health and safety issue. It should be treated that way under the law, and it's time we protect our tenants from that as well. So with that, let me turn it over to Dr. Bridges.
Thank you, Councilmember Hucker and Jawando, for allowing me to speak this afternoon on behalf of Dr. Gales. Dr. Gales couldn't join us today, as Councilmember Hucker said. He's meeting with Secretary Neal. However, he asked me to briefly talk about some of the work that we're doing to address chronic disease management as they are related to excessive heat causes. particularly cardiovascular disease and respiratory illnesses. Data points to surveillance that we have from 2014 to 2016, where heart disease is ranked number 2 and chronic lower respiratory disease is ranked at number 5. So you could see the importance of this bill that's related to heat exhaustion and the lack of air conditioning. With global warming reported based on the research by our epidemiologists, high temperature events and mortality has been well documented, with evidence suggesting substantial increases in mortality from respiratory and cardiovascular disease. In a recent article in Environmental Health Perspective Journals suggests that the effects of excessive heat conditions and respiratory illnesses or chronic diseases can increase hospital admissions, disease management, and increased healthcare costs for not only the county, but individuals who come to the county to live, work, and play. In other respiratory and health endpoints, it is pointed that because climate change is anticipated to increase over the next 3 to 10 years, policymakers should develop more climate-impacted adaptation to legislation that impact positive outcomes to chronic disease management. So I'll get to the crux of the matter. Also, a growing percentage of the population will likely be particularly susceptible to heat-related respiratory morbidity. Studies have also consistently indicated that acute respiratory heat effects are likely caused by a direct impact on breathing hot air. So where does this lead us? At the Department of Health and Human Services, we have procedures in place where we have heat advisories, heat activations, cooling centers, etc. But that may not be enough to impact and mitigate the risk of heat exposures. So that's where we are in public health. We're looking at the surveillance and data impact on excessive heat and respiratory and cardiovascular related illnesses, which speak towards this bill. Lastly, to conclude, public health prevention strategies and legislation must also consider the effects and early indicators of extreme heat and heat stress, particularly for the elderly, disadvantaged and underserved populations, and other individuals with pre-existing conditions. I thank you for your time and allowing me to briefly share some of the science behind the risk associated with heat illnesses.
Thank you so much, Doctor. He wasn't in my notes, was a last minute addition, so I neglected to recognize. I want to call up my friend and colleague, Will Jawando, who is not only on the Fed committee. I'm really glad to have him co-sponsoring this bill. Please. Thank you.
Thank you, Tom. And I just want to commend Councilmember Hucker for introducing this bill and for your advocacy over a many number of years to make housing safe for all of our residents, tenant and homeowner. As you mentioned, on the Fed committee, we are focused on this like a laser as well. And next month, we'll have a hearing on my bill that will allow and supplement and complement your bill to allow people to break their lease, but also if their home units or rental units are deemed inhabitable and condemned by DHCA, they will be eligible for up to 3 months of relocation expenses in the form of 3 months of whatever their monthly payment is. So we're going to be building this plane together and continue on your work. I wanted to say, imagine, I know we have several of our seniors here, and they're going to share their stories. Imagine, a young person in an apartment building waiting, as in many of our apartments, this is the case, until that magical date that that your management company allows the heat to switch from heat to cool. And you're sitting by looking at the vent and waiting for that day. And then the day comes and it doesn't turn on. I say that not only just as an anecdote, I say that I was that little kid. I grew up in a Long Branch apartment that had that automated controlled date, heat, and AC. And that's a serious matter for our seniors, for our kids. There are life and death consequences, not just comfort, as was so made clear by our Department of Health. And so that's why this bill is so important. That's why we're going to pass it and make sure it gets across the finish line, and we're going to continue to do what we can to protect our residents. We have one of the earliest fair housing laws in the country, but our work is not complete until we make sure everyone has access to habitable, high-quality housing or rental property here in Montgomery County. So I want to commend Tom and thank you for your work on and leadership on this bill.
I thank Tom Hucker for submitting this bill because this bill is a good bill, and we all should understand that we need air because there's some of our tenants in Montgomery County, especially in Charter House, get sick and we have different problems. So seniors do have problems, so we need this bill. It's very important. Thank you, Tom, for inviting me.
Thank you.
Thank you, Mr. Hooker. I just got out of the hospital last week because we do need air as tenants, because especially I'm speaking on behalf of the seniors of Charter House and other places. We have different diseases and different things. I have heart problems, and being in a hot place like that and no air conditioning, and the landlord do not have to give it to us, we need a bill like that to pass. And I just want to go back in the past and I remember something that hurt me very much at Charter House. We had a tenant there. We didn't have air conditioning. The air conditioner was off. They couldn't get it right. That was about 3 or 4 years ago. And we found the man's body blown up. He had burst inside because it stayed in his apartment so long, and it was he was just a new tenant that just moved in. And because they have these regulations when they're gonna cut the air, it's not good for tenants. We have heart diseases there. We're retired, so we come there not well, and not even not in the Charter House or the senior living building. We need to have air conditioning. And I'm so happy. I just got out of the hospital, but I want to come in and support Mr. Hooker. I want to support him because he's...
So nowadays we're seeing more and more people move into rental housing, not as a temporary station, but as a way of life. And in that condition, we need to think about children who are in schools, who need to be stable and live in their homes year in and year out and not move from school to school. We need to think, of course, about our seniors and their quality of life and their health. But we also need to think about working families. If you're awakened at 3 o'clock in the morning because you can't breathe or because it's 95 degrees in your apartment, you can't perform as you're supposed to and be as productive. So it affects the entire range of our residents in terms of their health and their productivity and their quality of life. So I want to thank Councilmember Hucker and Councilmember Jawando and the co-sponsors for this bill. It's not a panacea. It's not going to solve everything, but it's going to solve something that's important. Thank you.
Okay. Thank you, Matt. Let me call up Julio Murillo from CASA.
Thank you, Councilmember Hucker and Councilmember Jawando, for being leaders and strong allies of the tenant community here in Montgomery County. And I'll be very brief because you guys have heard directly from our seniors. You heard the science behind it. You heard from another ally working with the tenant community. This is a common sense bill that is very much needed in the county, and it solves the real issues that real people face every single summer or winter, depending on the issue. And I want to highlight the fact that, as Matt mentioned, sometimes with an immigrant community, there are additional challenges that they face. They may be scared to communicate with a property manager, or there may be a linguistic barrier there, and they come to organizations like CASA seeking for help. And every single summer, we have the same issue where the AC is not working, and some of our tenant members are living in units that are extremely and dangerously hot. So as a result, we have to go out, and we work very closely with DHCA to really resolve these issues. But this happens every summer, and that shouldn't be the way that it should work. So we are very happy to see that Councilmember Hucker introduced this bill, and really hope that the County Council pushes it forward and passes it so we can resolve a real issue for county residents. Thank you.
Terrific. Thanks, Julio.
Thank you.
Reverend Pat Drumming from Rainbow. Come on up.
Thank you so much, Councilmember Hucker. I'm very grateful that we have a champion for us here in the county, someone who is a great advocate on behalf of tenants and residents all over the county for different issues. I know he's worked very hard over the last 2 years plus on this particular issue. And being a safety net provider, especially in the Silver Spring, East County, White Oak area, Piney Branch, Long Branch, we serve a heavy immigrant population, and many of those clients will choose the lower income properties because they're working jobs and they're going to school because they've come here for the promise of a better life, and we want them to have that. We want to help them to succeed in every area. And at Rainbow, we also have a food pantry, and we see countless seniors and families who come in with health issues and concerns. And one of the reasons they come to us is because we do provide a large quantity of food, but great fresh produce. But many times when they were sitting in our pantry, many of them had respiratory issues. So we were dealing with, in many cases, some of them about to pass out. So we understand the importance of the air conditioning. So we've had to even relocate our pantry and bring it into a cooler space to help them. So we want to always be there for them. And there's about 64,000 people living in poverty in Montgomery County. And for those, especially our seniors, many of them, they've worked hard, they've saved their lifelong, they've planned their futures, and with unexpected health concerns and conditions that take a lot of their budget, they're not necessarily eligible for a lot of federal programs and other programs. So I am grateful that there are people like Councilmember Hucker and others who are willing to be the voice and to speak for the people in need. Thank you so much.
Thank you so much, Reverend Pat. Anybody, did I leave anybody out? Okay. Thank you all so much for coming. Are there any questions we can answer? If not, we look forward to seeing you all at the hearing at 1:30. Thank you very much again for coming, and thanks to all of you for appearing in support.